Hello, everyone. Mr. Lipchick here, and our topic for discussion is behavioral therapies. John Watson pioneered the field of behavioral therapy. He was inspired by Pavlov's work and began presenting his own behavioral theories in the early 1900s. He was the person who coined the term behaviorism. He is most known for his work with a baby named Albert. Behavior therapies use learning principles to eliminate or reduce unwanted reactions. This approach deals with what is known rather than with unconscious conflicts. Behavior is focused on things that individuals can easily identify as a problem or source of conflict. Behavioral therapists teach people to replace undesirable responses in their day to day living. They will uncover irrational fears and show people strategies for dealing with them. Examples of learning based techniques include exposure therapy, contingency management, behavioral activation, modeling, and biofeedback. Exposure therapy encourages individuals to face their fear. Instead of avoiding the upsetting experience, they are encouraged to expose themselves to it in a relaxed state. This is considered better than retreating or hiding from it, as this behavior can actually make the fear worse. Two types of exposure therapy are used. One, wherein the subject actually faces the thing that he or she fears. And two, where the subject faces an imagined version of the thing that they fear. With time, exposure therapy can help people replace irrational, debilitating fears with more appropriate responses. In contingency management, desirable actions are reinforced with selective rewards. Undesirable actions can sometimes be penalized as a last resort. However, this is less effective as it produces unpredictable results. A common treatment for depression is behavioral activation. This involves creating a to-do list of activities and habits associated with living a normal, healthy life. Habits may be as simple as practicing good hygiene. It could involve having a conversation with a stranger to encourage sociability. The idea of the list is that naturally occurring rewards of these behaviors will reconnect a person to his or her self-worth, pulling them out of depression. The activities encourage an individual to do things that will produce or have a great likelihood of producing positive feelings like joy or pleasure. The behavioral therapy of modeling involves an individual observing another person performing a desired behavior. Once the person sees that someone else has done it without negative outcome, he or she can copy the same behavior. This is a slow process that requires much guidance from the therapist. With biofeedback, the therapist monitors the individual's bodily functions and reports information back to them. If the individual is made aware of a behavior's effect on his or her condition, it is believed that he or she will be more motivated to control it. Once the physical response to the stressor is dealt with, the person may be better able physically and mentally to deal with the situation. Biofeedback example: a person with high stress experiences an elevated heartbeat as a result. The person is taught to recognize when his or her heart rate increases. He or she then employs relaxation techniques to bring the heart rate back to normal. The individual can use this technique to deal with stressful situations in the future. That concludes our discussion on behavioral therapies. Thank you for attending, and I look forward to seeing you in the live lessons. Have a great day.